So, okay, you can start. So what are the indications of endotracheal suctioning? Where do you want to do it?
Secretion.
Thick secretions. Or you may see obvious secretions. You may hear adventitious breath sounds like bronchi, or you may see oxygen saturation going down. So those are some of the indications of performing endotracheal suctioning. So always remember, you need to assess your patient. In your competency to make sure that you are assessing the patients, checking the O2 sat. We may have the O2 sat here, or we may ask, okay, you can check my O2 sat or something like that. So you will have to assess the patient. There could be tachypnea, and you may see, like secretions coming out. Then you need to auscultate bilaterally on all lobes. Okay. Compare it. Okay. Then if the patient can sit up, like some more, like you can do the posterior, at least the posterior upper lobe, try to auscultate. Okay. Then you need to, position the patient, like a semi-flawless position is the best one to do the suction on a patient. And this is open suction, not the closed suction. The difference between open suction and closed suction is like you are doing on the tracheostomy. On the closed suction, most they will be on the ventilator. It's an inline suction. Okay, so few things you need to know. What size of the endotracheal tube the patient is having, because based on that you're going to choose a suction catheter. Okay, not like if it is a smaller endotracheal tube, you cannot pick a bigger one. So one of the rule is, like you check the number of the endotracheal tube size, then you suppose, for example, the endotracheal tube size is 7, okay, times 3 is what? 21, right?
Mm-hmm.
Then divide by 2 is
10 and a half.
10 and a half. So you may choose a 10 size catheter or a 12 size catheter. Okay. So suppose if it is an 8 size endotracheal tube,
16.
8 times 3 is 24 times 2, so it is 12 size. So that's one of the general rule people follow, and most likely when you are especially in a pediatric hospital or somewhere, lot of ventilator patients, they usually have a cabinet, and if you open the cabinet, it will tell you what type of endotracheal tube is there, and what size is the endotracheal tube, and what size of suction catheter you need to pick, and how much to insert. Everything will be like an accurate measurement will be there. And do you know how much to insert?
Until you hit the carina.
Yes, till you feel a pressure or the patient cough, right? Then you pull a little bit, then only you apply suction. When you insert, you don't apply suction. Okay, remember that. People make that mistake. So when you remove it, apply suction intermittently, and roll it, because you want to get all the sides too, and remove it. Okay, roll it, remove it. Okay. So intermittent suction. In your ED textbook, I think it says continuous suction. So remember that intermittent suction. So that's those are the few things. And inline suction, usually there are color codes like red, yellow, green. So I think that's one of the most effective way. And you only insert that much. How much to insert? You go up to the green, do it. So it is less chance of creating any injuries. Okay. So the first thing we'll be doing is, so I want to check everything is good. So because it is tracheal suctioning and tracheal care, because you will have a competency together, right? So if you have a competency, or if your patient needs both, which one you will do first?
Suction.
You will do the suction first, because that's kind of an emergency. Care is not an emergency, right? So tracheal suction is the first thing to do. In your kit, you have a suction catheter and you will have a blouse inside too. And the suction tracheostomy care kit will have a towel and fenestrated, the dressing, gauzes, cleaning materials, everything. Then this is the disposable cannula, and you will have disposable cannula. Usually we do disposable cannulas, and rarely you will see the reusable ones. One time I was teaching this, and then they said very rarely we do them. And the next day when I went to Putnam Hospital, there was a patient with reusable cannula. But for your competency purpose, we are not going to take the reusable thing, cleaning, all that, okay? So only the disposable type we are going to do. I'm going to demo here, and you're going to do the same thing in your competency too. So these are the kits. So I need to keep something under the patient so that, there is most likely the patient is going to cough and all that. So you don't want secretions or any spillage on the. So I'm going to put a clean gloves. Now what I'm going to do is, I need to check everything, because we're going to do together. It is an easy thing, an easy way to remove this dressing early enough, okay? So before that, let me check all my functioning is there. Suction, okay, it is functioning. So how do I check it? Upload it, all right? It is functioning. I'll have my ammo bag ready. Then I can take this dressing off. You can do both ways. You can do, once you finish the suctioning, you can put a new pair of gloves, remove it too. But this makes it like one step easier, okay? So take that, throw them, okay? Reusing everything, right? So, all right. So we did that. What is next? Now I'm going to set up the suction, right? So I auscultated, assess the patient. Okay, oxygen saturation is bad. There is a wrong guy. Okay, now I'm going to open the suction catheter. Okay, it has a catheter and gloves. Because I used the gloves already, I have another pair of gloves. And at this time, I would have this kit ready, because I don't want to have, once I have my gloves, I don't want to struggle with that, okay? Keep it ready. So you can even pour it here, now or even later, okay? Both ways fine. Once I have my gloves, this is considered my sterile hand, this is going to be my clean, or the one going to be contaminated. So I can even pour now and keep, or I'll do both ways. I can even do this way now and keep it ready, or I'll show you the next way, okay? This is the struggle, right? So I would say, I don't know what size is going to be in your trach kit. So I would always say, pick a pair of gloves which is one size larger than your actual size. Because that's the time you're going to struggle trying to put a tight glove. It's not that easy thing, okay? So now, what you can see is like, this is going to be my sterile hand all the time, right? So this is going to be dirty now, okay? So I can pour it here. All right, now I want to test suction, if it is working. Okay, so when you pick this, be careful, okay, and when you manipulate these things, be careful that you're not touching anything. This catheter should be always sterile as much as possible you can, okay? So, and you should not be touching with this hand anywhere here. this hand can only go up to here. Okay? Look at this, what happened. This happened one time with my student too when she was suctioning. So if that ever happens, I would say, as you're doing it, and if you don't have the time to redo them, please request me. I can offer one for you. We are not that difficult in those things, okay? I can always help you. So make sure you have it tight. Okay, now I want to test it. It's perfect, okay? So careful with this holding. Whichever way you hold, fine, but it shouldn't go. So at this point, I want to hyperoxygenate the patient. Okay. How many breaths? 1, 2, three. So what is next? I should not occlude this, right?
Right.
So I'm going to insert it. I feel the resistance, pull a little bit. Now I'm going to
Intermittent.
okay, rinse it. So I want to do it again. Remember, coiling and holding has to be carefully done. Okay. So I want to do it again. Then like between that, immediately you have to put the oxygen back. Then so I want give 30 seconds at least between the passes. Okay. If you think your patient is good, you don't have to do more passes. You will do only maximum 3 passes. Okay. So put this back. Now again. Insert. So I feel the resistance or the patient coughs, Okay. Now apply suction. Okay, rinse it. This is I'm also examining if everything looks good, if there any bleeding, and what is the color of the secretions, all that. Okay. Alright. Now I'm done with this, right? So I'm done with this. The oxygen is tray collar is back on. So how do I discard this?
Roll it in your glove.
Okay. So whenever you want to do the suction, I would tell you that, don't go from down. The chances of that you're going to touch the catheter on the patient's clothes or the towel, high. Okay. I would always go like this. Okay. Make sure with your, have your eyes and have a good coordination. See where you're going. Okay. So now I would coil it around if I can. Disconnect it. Remove it over my blouse. Okay, that's it. Close them. Right? So that's about suctioning. The next one is the trachea. So I always want you to do as a 2-step. Some people were, even though I tend to do everything together. When you're an experienced nurse, it's fine if you have that much coordination. But if you have everything set up in one field, if something happens, you will have to get everything back again and start all over the whole thing. So I would always do like a 2-step process. Okay. So this has to be thrown. The next is here. So we are going to get ready for trach care. Okay, trach care. So here is the you have the box here. Open that and take this towel. Now you can have your clean hand. Just get this towel. Hold it on this edges. Shiny side down. Down. And this is going to be my sterile field. Okay. Open this. Because I reuse them. So open this. Open this. Drop it down. Okay. Now I'm going to put my gloves on. I use a bigger gloves because for the easiness of demo here. This happens to you too, guys, when you are trying to get the gloves, right? This goes falling back, going back. All right, so keep practicing these skills, okay? Now I have one out, don't worry. That we can fix it. Now I can take this stuff. The trach care, although we try to consider everything like sterile as much as possible, it is not perfect all the time. Take this out. This is the container. You could have, sorry, I shouldn't have put that closer. Okay. Now, the Q-tips. I would strongly suggest you use Q-tips than the cleaning with the gauze pieces. Q-tip is more easy for you. Okay. Draw this out. So I have everything ready too. Now I'm going to make this hand dirty. Pour the saline. Okay. Now I have this already, the dressing is already taken, right? So that's why I skipped one step because it was easy for me to take it out in the beginning, right? So now the next thing, I'm going to change the cannula. You have to have this all ready. It has to be done quickly. So I would have the cannula with my good hand, under my right hand, and I'm going to take it with my left hand. Take the clip and pull it. Okay, and immediately replace the cannula and have the clip down. Okay. Now, in reality, I'll tell you this. It's not always easy to take it out with one hand and put it with the right hand. But I'll tell you, if that ever happens, then I'm supposed to throw this out, right? So pretend that this is a good cannula too. If you're trying to take it out with your left hand, you're having some tough time there, right? Only in those situations you can do is like, you can stabilize this, use this hand, okay? Remove it, throw it, and this time remember, you are taking the cannula only from here, this side. So it is still good, okay? This can happen in real life situations. That's what I'm telling you. If you don't have someone to help you immediately, this is how you should do it. So as long as you are not touching this part, because remember, this is going to touch the trach collar, this is going to touch the this part is not going to be, whatever is going inside the tracheostomy tube is the one you have to be careful. Okay? Now, if you think about the care is not completely sterile technique, but I'll say for your competency purpose, I would tell you, strongly recommend you use this Q-tip so that you can do it more, as much as possible, more like a sterile way. Okay? So, you wet it. Okay. Bring it around, pull it down, throw them, take another one, okay, throw them, dry it, throw it, now I need to throw that out too. Now I need to put this pressing back, right? So try not to touch the middle of it. Hold it from the corner like this and slide it through. Slide it, but you cannot easily slide. So what you're going to do, you're trying to insert with your other hand now like this. Pull it, both ends, insert it through the tie and pull it. So it sits there nicely, okay? Get it? Now, changing the tie, we don't want you to be changing the tie in your competency. If you need 2 persons, it's better to have 2 persons, if you are changing the tie. If you are alone, put a new tie, fully secure it, then only you will remove the old tie. If not, what can happen?
You can pull it out.
Patient can, one cough, it's out, right? Then you're dealing with another emergency day. I think that's it. Do you have any questions for me? Did I miss anything?
So you're suctioning, then you're taking out the
You're suctioning, then you're taking out the cannula,
Then you're-
replacing the cannula, then you're doing all the
but you're suctioning and then you're gonna re-sterilize yourself again.
Mhm.
Take the plastic can, take the throwaway out, put the new one in, and then clean it, right?
Yes.
Right. I know that
So
you
two
just did that,
step.
but I wanna make sure I got
This was the first step. With suction,
Clean the-
sterile gloves, everything. The next thing, you don't open the whole set first. Take the suction kit first, open, then you do the care kit. Okay? Do it like a 2-step because the EC, like when you have too many stuff, you may accidentally contaminate, and probably sometimes we don't see ourselves when we're doing stuff, I think that's it.